So when the frown lines are in the early stages and they're just starting to form, often treating them with Botox on their own is enough. When they become a bit more established and they get a bit deeper like this, if you want to get rid of them completely, then Botox on its own is not going to be enough. So what we're going to do today for Michelle is pop a little bit of filler into the deepest part of the fold, and also as well as restoring that bit of volume in there, we're going to relax the muscle as well. Michelle's also got a couple of little lines coming across the top of her forehead as well, so we're going to use a really gentle dose of Botox across the frontal muscle. That's more preventative. You can see that the lines are starting to form at rest. They're nice and superficial. They don't need any filler in them, but this one here, where it's a bit deeper, to get a really nice result here, we're going to want a wee bit of volume in there as well. So we're going to use some filler in here, some Botox in here, and then a little bit of Botox across the muscle at the top. Okay. So when I'm performing these injections of filler directly into this little line here, I'm being extremely careful and extremely superficial with where the filler is being placed. In this area, there's a couple of really important blood vessels that are connected to the eye that we absolutely must not inject any filler into directly. At this point, although they're in a similar location, I know that they are very deep and on top of the bone, so I am placing the filler in this location really superficially directly into the skin. Although it looks quite simple, it's actually quite an advanced technique, and it's really important that this is only ever done by the most experienced practitioners. So with this treatment, we're not going to see very much immediately. It's going to take 2 weeks for the effect of the Botox to kick in. Yeah. So we're going to immediately just see a little bit of redness from the injections. Mm-hmm. And then it will be 2 weeks from now that we can really see the benefit of what we've done. Now we've filled the lines, we're going to use some Botox. And we're going to use a really nice light dose across these lines that are coming across the top of the forehead. Raise your eyebrows for me for a little second. Just lift up. Thank you. And relax any second. Okay. So this is a really tiny needle, which is usually not felt by most patients. And the main reason that people usually inject incorrectly is that they inject too high. The process muscle in the middle is more down here. I sometimes see people injecting it up there. And then the corrugator muscles come from the bone here up to the skin here. So the injections need to be down almost within the eyebrow on either side. And what I quite often see people doing is injecting up above the eyebrow, about 1 centimetre above the eyebrow. And the problem with doing that is that you miss the muscle you're trying to get to, and although it weakens the frown, it also over-treats the central part of the forehead. So it pushes the eyebrows down, so it makes the eyebrows heavy in the middle and up at the end, and it gives it that sort of classic Botox look, which is not attractive. So we're going to position the Botox in the correct muscles, so that what it should give us is a really nice, natural softening of the lines, without any of the telltale signs of Botox. You okay? Mm-hmm. And that's us. All done.